Say it's shaping up to be a very hot week, and the danger of getting a heat-related illness rises alongside the temperatures. Joining us now live to talk more about what you need to know about heat exhaustion and how to prevent it is Dr. Shideh Chinichian. Dr. Chinichian, thanks so much for joining us this morning. We appreciate your time.
Good morning. Thanks for having me.
First of all, who do you think is most at risk for heat-related illness?
So I'd say infants and young children, as well as elderly and pregnant women would have to be most careful. And those who work outside or are obese also are most at risk.
Why do you think that is, especially children and elderly specifically?
They tend to be more prone to dehydration, and one of the main things that we have to worry about, especially with this extreme heat that we're going to have, is hydration. That's really a key element, and they have to be most careful not to get dehydrated at this time.
And what is the best way to stay hydrated? Is it as simple as drinking water, or is there more that we should be doing?
Great question. So yes to water, but you also want to incorporate some electrolytes. So along with your well-balanced diet, make sure that your water, you can do some, electrolyte infused water, coconut water, watermelon, and then your regular water is good. You just make sure you keep that with you and have it handy, and drink even when you're not thirsty in this heat.
And what about like those, energy drinks and like Gatorade, some of those other brands, Powerade? Do you suggest those things as well?
So Gatorade or electrolyte drinks are okay. You got to be careful with anything that's caffeinated, or maybe some of those energy drinks. I was also going to mention alcohol is another thing, and tea and coffee. Be careful because they tend to dehydrate you more, even though they are still liquid. But you have to be even more careful with those.
Gotcha. That's pretty interesting. So one of the things we often hear about too is like your body temperature and your body temperature rising. What's the best way to actually regulate one's temperature?
So you want to try to stay as cool as possible. So trying to not go outside in it, during the peak heat times. Stay in the shade, drink cool water, take some cool or ice bath, or cold showers. Those tend to help a little bit more.
Yeah. Talk about the common signs of heat exhaustion and heat stroke. So if folks aren't going to take your advice about staying hydrated or staying indoors, how do they know if they are dealing with a heat-related illness?
So you may be experiencing some headache, dizziness, muscle weakness or muscle cramping, nausea, vomiting. Sometimes it can get, you can have fainting, elevated heart rate, or low blood pressure. But in extreme cases where we are thinking even heat stroke, you might have altered mental status or confusion, in which cases you have to seek medical attention immediately.
Yeah, and would you suggest like going to an ER, or would you say, folks should just call their doctor?
So in cases of heat stroke, if there is altered mental status or, people lose consciousness, that is an immediate 911. We do have to do immediate cooling protocols for that. But if you're having milder symptoms like, weakness and nausea, vomiting, you can call your doctor and, seek their advice before, calling anyone.
A lot of good information. Dr. Chinichian, thank you so much with Dignity Health. Thank you so much for being with us this morning.
Thank you for having me.
All right, folks, turning